Hello, my name is Corey Black, and today I will be explaining a system designed to provide remote healthcare to patients and to access underserved communities. I'll start off with the three strategic goals for this project. They are to provide digital tools to connect providers to patients, methods to send healthcare results directly to a patient's health ecosystem, and to evaluate the impact this has on underserved communities. The business problem we are trying to solve is to provide a potential solution to the problem of remote healthcare and access to remote healthcare for unserved, historically marginalized groups. If I were to state this as a systems design question, I would state, how can we create a system to deliver remote healthcare and access to remote healthcare for underrepresented groups? And the requirements of the system are that patients must be able to connect to healthcare providers digitally, easily, quickly, securely, privately, and at no cost to them. Patients must be able to receive and have information sent to their healthcare providers easily, quickly, securely, privately, and at no cost to them. Patients must also be able to access their healthcare information privately and securely at all times, and to be able to access the information in one easy-to-use place. The system must also take into account and provide for underrepresented groups. Now, all of that is great, but what are the actual features that the system would use? Well, first, we would use video conferencing software, and we would use this video conferencing software to be able to have patients be able to directly communicate with their healthcare providers. They would be able to do this digitally, easily, quickly, securely, privately, and at no cost to them. They also have to be able to use login credentials to log in to an account and be able to have a contacts list of all of their healthcare providers and be able to see when their healthcare providers have called them and be able to schedule a meeting to call their healthcare providers and communicate. An online portal will be established with private, secure, individual login credentials to allow patients to access their healthcare information at all times, privately, safely, securely, quickly, easily, and at no cost to them. This online portal will focus on ease of use to allow patients to access and send results of tests to and from their healthcare providers, and to see all of their health history and to get all of their health information in one place. We will also initiate a community-based program that will send healthcare providers into underrepresented communities to be able to engage with them. They will do this on an individual, small group, and large group level, so we can focus on accessing and reaching the people that are hard to reach. Mail will also be used to account for underrepresented groups, and this will be an opt-out system where patients would opt out if they do not want the communication, and they can do that over mail, online, or by the phone. Now, what are the actual functions we're going to need in our software to provide these features? Well, for the video conferencing feature, we have a call button, a receive button, an upload document button, a chat button, a share screen button, a turn off on the camera button, increase or decrease volume buttons, in call button, a contacts list button, an add contact button, a settings button, login and username text boxes, login button, and a log off button. And for the online portal, the functions to provide the online portal feature will be login and username text boxes, login button, log off button, health information button, test result button, schedule meeting button, health history button, access to your calendar via a calendar button, upload file button, download file button. And to explain some of the background and summary of this system, the background is that this system was created out of a need for increased remote healthcare options that arose during the COVID-19 pandemic. And a little summary of the system is that the system offers methods for patients and healthcare providers to send and receive healthcare information and test results digitally. It is designed to be easy to use, safe, secure, quick, no cost, private, and available at all times. The primary stakeholders for this would be healthcare providers, patients, healthcare labs, pharmacies, employees of healthcare providers. The secondary stakeholders for this would be the general public, the health department, regulators in the health department, the family of patients, the parents and guardians of patients, personal caretakers of patients, and activist groups. That is the breakdown of my summary of my remote healthcare access for patients and video conferencing and serving underrepresented communities. I hope you enjoyed my time.